Hello and welcome to the CSR Journal. Hope you all are doing fine. Heart health is the most important for all of us. If your heart is healthy, you are healthy. Today, on the occasion of World Heart Day, we have renowned cardiologist Dr. Debdatta Bhattacharyya joining in from Kolkata. He is associated with Kolkata's Rabindranath Tagore International Institute of Cardiac Sciences. Hello, sir. Hello and welcome to the CSR Journal.
Thank you.
Sir, today is World Heart Day, and as we all have seen, there's in the latest trend that cardiac problem among youngsters is increasing, and not only cardiac problems, but people are even dying from that. So, if you would like to comment on that.
Thank you for asking that question. I think it is very important. India is a young country, and we have a lot of people in the 30 and 40 age group, and that is going to increase in the next decade. What is worrying is that a lot of our patients are now coming from this group of 30 and 40. We have even treated heart attacks in 20-year-olds. It is a very worrying trend, and it is happening. And even we have seen young patients who have gone for a bypass operation before they got married.
Sir, if you could throw some light on the major reasons why this is happening, especially among youngsters.
Yes, I think it is because our lifestyle has changed and the risk factor profile as a result of which, the change in lifestyle has become more adverse. So how has it changed? If you go back 30 years, you would see that youngsters, they were active outdoors. They were playing in their teens or in their childhood. They were all out in the fields playing cricket or football or some outdoor sport. Now, this trend has started to change. They began to change from the end of the 20th century. The first decade, we saw that more and more children, they were more inclined to be indoors rather than outdoors. And a lot of this has resulted in childhood obesity, in altered dietary habits. We now see a lot of fast foods that are popular amongst youngsters. The other factor is, of course, smoking. The amount of smoking that was prevalent earlier amongst youngsters has increased. And we have seen an earlier onset of hypertension in youngsters. Some who are in their teens, we have seen them starting to take antihypertensive treatment. And this steadily increases over their 20s and 30s. And by the time they are late 30s, some of them are falling ill due to coronary artery disease. So also diabetes. I think we have millions of diabetic patients in our countries, and heart being the most important organ in the body, if it gets affected, it affects the whole body.
Absolutely. Sir, we often associate a sedentary lifestyle with cardiac problems, as you just mentioned. But sir,
Yes.
There is a recent instance we all have seen that renowned comedian Mr. Raju Srivastava, he had a cardiac arrest while working out at the gym. And after being in the hospital for over a month, he passed away. So, sir, how do we do this? Should we then not work out? Should we not go to the gym? So what is the solution to this?
I think we have to be sensible about what we are doing. I know that a lot of people in their 40s and 50s, they have become aware that sedentary lifestyle is bad, and they have started to go to the gym. I can tell you the story of one of our colleagues who was in his early 40s, who started going to gym late in his 30s and late in his career. So in the 40s, he had never gone to gym before, and he started weight training. And one day he had an intracranial hemorrhage, a bleed in the brain. So people, as I said, people are in our country, they become vulnerable at a younger age, in their 30s and 40s. And if they have underlying heart disease, which is unrecognized, which is often the case, such tragedies can happen. So if someone is going to take up an exercise regimen and they have not exercised for a long time, it is better to be under the guidance of an instructor who knows how to pace the subject through various. So what I mean is you should not go and start exercising all of a sudden to a very high level, because that can cause problems. And if you have a history of heart disease, or if you have had any symptoms, or if you, even if you had no symptoms, if you are contemplating an exercise regime, it is better to consult your doctor if you're in your late 30s and 40s. And that would prevent some of these tragedies from happening.
Sir, we all know that cardiac problems, like a heart attack, always comes with a warning sign. Sends some kind of a warning signal to the body. Sir, if you could just educate us a little about what are the warning signals, like how do I know if I'm having a heart attack or not?
Yes, unfortunately, chest pain, which is a warning signal for coronary artery disease, often is not present previously in patients with heart attack. In other words, the first attack of chest pain that a person experiences could be the myocardial infarction pain or heart attack pain. There are patients who will experience chest pain over a period of time, maybe 1 month, 2 months, or 3 months, and they have a warning. So they get the warning, they see that they get a pain in the center of their chest going up to their jaw, radiating down the arms, more in the left arm than the right. And they will see a decline in their exercise performance. So if they have been able to walk, say, 1 mile, they would see that after a few steps they're getting chest pain. And if someone notices a sudden decrease in their exercise capacity, and that is mostly shortness of breath, that could also be a warning signal of a heart problem. Apart from this, tiredness, palpitations, waking up in the night with chest discomfort, all of these are warning signals. But at the same time, I don't want to cause panic amongst people, because chest pain can happen due to other factors as well. So if you have chest pain, it doesn't automatically mean a lot of that you have heart problems. Just consult your doctor. Blood pressure should be checked, I think, quite regularly, because as I said, we have a lot of young patients in their 30s, 40s who have blood pressure, even in their 20s. And blood sugar and cholesterol levels should also be checked. If if the subject has someone in the family who has died at a young age from heart attack, they are at greater risk and they should be more vigilant. And smoking is an absolute no. If you are smoking, then you are at least 4 to 5 times at a higher risk of getting a heart attack. And smokers are prone to sudden cardiac death.
Sir, if somebody is smoking inside a room, and I am also present there, can I fall prey to heart problems due to passive smoking?
Yes, absolutely. Passive smoking is a definite entity, and people didn't realize it. Is that those who are around you, they also get affected by that stream of smoke that is circulating in the room. Everyone should be aware. Smokers should be considerate. They should be aware that they are harming people around them, especially if they're at home and they have children. Definitely, they should get the children out of the way if they want to have a smoke.
Absolutely. Very rightly said, sir. So one final question we have for you today. Today being World Heart Day, we would request you, sir, to kindly share some message to spread the awareness for our viewers.
Thank you. I think my message is heart attack and heart disease is a real problem. Unfortunately, what we have seen over the first 20 years of this decade is that it increasingly is affecting younger people. Earlier, it was a disease of people in their 50s and 60s. Now it is becoming more common in people in 30s and 40s as well. So we have a huge problem at hand. This is health, a large health, national health problem. And we have to fight this together. And the general public should be aware that of the features of a heart attack and seek help as soon as possible, because earlier the treatment, the better. And in general, they are to follow some healthy tips of living, such as regular exercise, a balanced diet with plenty of vegetables and fruit in it, less amount of oil and sugar and salt in the diet, avoidance of fast foods, and regular checkups when they have reached a certain age. Uh, Make sure that the diagnosis of hypertension, diabetes, and high blood cholesterol levels is not delayed for a long time. And smoking is an absolute no. If you are smoking, then you are harming yourself, you're harming your body, and you're harming also people around you.
So true, sir. Rightly said. Thank you so much for joining in. It was a learning experience talking to you. And thank you so much, sir.
Thank you. Thank you.